Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. This is a webinar where we're going to talk about Lyme disease. I'm interested to see what questions you have tonight. And as you all know, these webinars get created by you and the questions that you have for me. I hope you don't stump me too much. Every now and then you do, but often if you stump me, it usually means it's something I need to look into a little bit more. Which is good because then I learn some things, and sometimes there are things I even introduce to my patient care here at my medical practice. The way this webinar works, for those of you that are new here, welcome. And there's a couple ways that you can participate. One is to write a question to me, and you can do that over on the bottom side of your right-hand side of the screen. At the bottom, there's a chat box. You can write your question to me through there. Realize I don't get through every question every night because there's just too many of them, but take a try and maybe I'll get to your question. I do get through a lot of them each week. The other thing when you're writing your question that I ask is do not hit the enter key until your whole question is written. The reason for that is each time you hit the enter key, it actually sends a separate question to me, and that can get to be difficult to manage from my side as I'm trying to piece together the different parts of the question and come up with an answer for you. The second way you can participate is just listen to the questions and the responses that I give. There's always some good learning that takes place from that, and some ideas that you might get regarding your care as well, too. So if you are new, welcome. And for those of you that are back here, again, I see quite a few names on my message board that are people returning. I'm glad that you're coming back and that you seem to be getting, or that you keep getting some help from this as well, too. I am creating a recording of tonight's webinar, and so tomorrow morning, somewhere around by 9:30 in the morning, you will get an email from me which will tell you that the recording is ready to be seen, and it also includes links to see that. Now, if you should happen to miss that email, it's easy to find my recording because you just go to the webinars page at treatlyme.net. That's my Lyme disease information site. Just go to the webinars page there and you'll see the recording. It's down towards the bottom. Okay. So they show up there whether you get the email from me or not. Anyone has access to be able to see those as well too. The one thing I ask tomorrow morning, when you get the email from me, if you found these beneficial, keep in mind that most people with Lyme probably would find it beneficial too. So if you have people you know that have the illness that might benefit from some of the ideas we discuss here, feel free to share those emails with them, including the one tomorrow and any invites to future webinars as well too. Okay. All right. So without any further ado, let's go ahead and get started. One last thing. During the webinar, I will be posting, for those of you that are participating in Live's version, you will actually be able to see the questions. I will post them on your screen. In the recorded versions, they don't show up. So I'm going to read them also so that people in the recorded versions know what we're talking about too. Okay. All right. So let's go ahead and get started here. Hello, Jim. Let's see. Thanks for doing these webinars. You're welcome. Let's see. You've mentioned that sometimes you use Diflucan for Lyme. Specifically, how do you use it? How much do you prescribe and for how long? What instances do you use it in? Okay. So everyone, Diflucan is also known as fluconazole. And fluconazole and Diflucan are approved to treat yeast. So one reason I would use it in Lyme disease is to treat too many yeast that are growing in the intestines or intestinal yeast overgrowth, okay? But the class of medicines that Diflucan, fluconazole is in are known as the azoles. So Diflucan, the generic name is fluconazole, azole, okay? And so it's in the azole family. And other members that are in the azole family include metronidazole and tinidazole, and we use those in Lyme to treat the cyst form of the Lyme germ. All right, so as many of you know, Lyme lives as a spirochete, and it has another look, and that's called a cyst, okay? And the spirochete and cyst are not to be confused with something that we call persisters, okay? So what a persister is, many of you know the world of Lyme has been changing lately, and we're now all talking about these things called persisters. Persisters are hibernating forms of spirochetes and hibernating growth state of the cyst, okay? So there's two ways the germ looks like. There's spirochetes and there's cyst, and these spirochetes and cysts can be in a growing state and they can be in a hibernating state. And in the hibernating state, they ignore the standard antibiotics we throw at them. We call those persisters. lab experiments say maybe about 10% of the germs turn into these persister states, okay? All right, so back to the azoles though. So the azoles of tinidazole and metronidazole we use to treat cyst. And they're in the same family as the fluconazole. So sometimes when I've got people that are having difficulty tolerating tinidazole or metronidazole, I may use the fluconazole as my cyst buster in place of it, okay? So when I use fluconazole to treat yeast, intestinal yeast overgrowth, or for cyst busting, I'm usually going to dose it for an adult at 200 milligrams 1 time a day, and I use it continuously, okay? Now, there's one added part about Diflucan, and this is based on a protocol by an English physician that was popular a number of years ago named Chart, and it's called the Chart protocol. And what Dr. Chart contended is that fluconazole, Diflucan, could interfere with the detox mechanisms of the spirochete, the Lyme germ. And so in his protocol, what he would do is he'd have people be on Diflucan, I believe, for about 30 days. And then he would have them take amoxicillin, which kills spirochetes, for about 50 days. And he would alternate, I think about 50 days of amoxicillin. I may be getting my times just a little bit wrong, but it was be on amoxicillin for a bit and then be on fluconazole for a bit, okay? Now, the reason he was doing it is, again, he contended that fluconazole interfered with the detox mechanisms of the germ. And so if you made it so the germ couldn't detox, it would be more easily harmed by the amoxicillin. Now, maybe that's so. And maybe one of the reasons I see benefit when I put people with Lyme on fluconazole, maybe some of it is from killing cysts, but maybe some of it is also from interfering with the detox mechanisms too. Okay. All right. And then more recently, I'm wondering, and I'm trying to see if this is going to be the case or not. And that is, I am wondering if the azoles, fluconazole, may also be beneficial for treating the persister forms of Bartonella. All right. So both the Lyme germ and Bartonella have the persisters, both can. Okay. Now, why would I use a yeast medicine to treat persister Bartonella? Okay. Well, if we look at Ying Zhang, Dr. Ying Zhang in his lab at Johns Hopkins, over a year ago now, studied various drugs to see what would work against persister forms of Bartonella. Not Lyme in this one experiment, but the experiment was just looking at Bartonella. And what he did in the experiment is he chose one member of various families. So for instance, for the tetracyclines, he used doxycycline. And for the macrolides, he used azithromycin, not clarithromycin, which is Biaxin, all right? He used rifampin and not rifabutin for the rifamycins, okay? And for the azoles, he chose a medicine called clotrimazole, which we usually use to treat yeast infections of the skin or ringworm infections of the skin, okay? So it's a skin medicine. But the clotrimazole worked well. So I know a number of my colleagues have had it compounded, and they're using clotrimazole. I haven't been wanting to pay the cost to get that medicine compounded for my patients. I've been trying to use fluconazole for some of my patients, the Diflucan. It's a little bit early for me to say whether it actually is beneficial there or not, but I'm trying to see, and I may be able to report back to you in the future about that, okay? So if I'm using it for Lyme, or if I'm using it for yeast, or if I'm using it as part of Bartonella protocol, which I might sometimes, I'm going to dose it at 200 milligrams, 1 pill, 1 time a day. Okay? All right. Thanks for that question, Jim, and good luck to you. Hello, Sita. Let's see. Can doxy capsules be stored in a refrigerator long-term, or does it have to be at room temperature? I'll take these one at a time. So on that one, I actually don't know. I would talk to a pharmacist and see what they have to say. I don't see any reason why being at a refrigerator would hurt it, but to get the accurate information, I'd talk to a pharmacist. I don't know that one off the top of my head. Is the alcohol content in Byron Wright herbal tinctures enough to avoid while on the doxy? No, you could mix alcohol along with doxycycline. You could even do beer if you want to. I mean, is a form of alcohol. I'm not advising that you drink alcohol to that quantity, but there isn't any reason not to be able to use doxycycline with various levels of alcohol. Okay. how many hours before or after doxy should things like grapefruit seed extract, hyaluronic acid be taken to avoid drug interactions? Those ones that you just mentioned, I would take them all at the same time. I have my patients routinely take doxycycline, grapefruit seed extract together, and I don't see any issues with taking hyaluronic, I can never say that word, but the hyaluronic acid at the same time, okay? And then can grapefruit seed extract be used at twice the dose you recommend for a total of 1,000 milligrams a day instead of 500? Yeah, I don't see why you couldn't. I'm not sure you actually need to use that much. I usually recommend that people use it when they're using it to treat the cyst form of the Lyme germ at 250 milligrams, one pill twice a day. But I don't see any harm in trying to go higher than that too. Okay? All right. Good luck to you. Hello, Rich. Let's see. How does Lyme and co-infections cause weak legs? What is the best way to treat this? So I'll make a couple of general comments, or general ideas for you actually, but to find out specifically what's happening in you, giving you those weak legs, I would need to ask a bunch more questions, okay? So weak legs can be caused by a number of things. Number one, your legs can feel weak or not work well if the nerves that are supposed to make those muscles work don't work well, all right? Specifically, the muscles may not get the nerve signaling to contract. There's another problem that can happen if you have nerve injury, and that nerves, in addition to firing the muscles or sending the electrical impulse that makes them work, nerves also release chemicals that cause muscles to grow and maintain muscle mass. So if you have a lot of nerve injury, whether it be from Lyme or trauma or Bartonella, you can sometimes have muscle atrophy and weakness from that, okay? All right, so that's one reason. Another reason you could have muscle weakness is as a part of just being fatigued from Lyme. You're going to feel weak all over. And that would be due to increased cytokines. And cytokines are inflammation chemicals made by white blood cells. When they see infections, they're good in that they're supposed to turn the immune system on. But if the immune system is having a bad time, it's going to make too many cytokines. And too many cytokines can cause muscle atrophy. Okay, so you can get weakness of your muscles from that. Too many cytokines can give you fatigue, interfere with your thinking, make you hurt all over, disturb hormonal function. So really what we call Lyme disease symptoms are really too many cytokine symptoms, but specifically with muscles, they can cause muscle mass loss or muscle atrophy as well too. Okay, so that's another reason. All right, and then a final reason that people can get muscle weakness is when you have chronic infection, or if you have chronic mold toxicity sometimes, one of the things that can happen as the immune body responds to this is that the energy factories that give you energy for your muscles to work and your nerves to work and your immune cells to work, those energy factories are called mitochondria, and the covering on the mitochondria can get injured. If the covering of the mitochondria gets injured, inside the mitochondria, you're going to have difficulty creating cell fuel. Inside mitochondria is where sugar and fat are burned through a bunch of chemical reactions to create a type of cell fuel called ATP. The covering of the mitochondria, when you have infection and you have mold toxicity, one or the other, one of the ways the body responds is by making a bunch of oxidizing agents. And those oxidizing agents can damage the fat membrane that makes up your mitochondria. Okay, so you could have poor energy generation making you feel weak as well too. Okay, so there's three things that might be going on. One would be possible neurologic dysfunction giving weakness. Number two, inadequate energy because of mitochondria injury. And then last, you can get just muscle wastage from having too many of the cytokines, okay? And to help sort that out, I would need to ask you a bunch more questions, which I can't do in this format, okay? But those are some thoughts for you to think about. Good luck to you, Rich. Hello, Patsy. Hi, Dr. Ross. I hope you were able to enjoy some Florida sunshine. Yes, I even have a little bit of a tan. Thank you. Actually, Patsy and everyone. So last week I was at the ILADS meeting down in Orlando. And but prior to that, my sister lives down in Sarasota. So I flew into Orlando and then drove over and saw her for about 4 days and spent plenty of time on the beach with her. So that was lovely to be able to see her. And then I went and spent time in a refrigerator room at one of the hotels near Disney, and learned a lot of things, some new things about Lyme disease. So, but yeah, I was there. Thank you for that. Let's see. Do you have any new or outstanding info to share from the ILADS conference? Thank you for all you do. So the ILADS conferences are always interesting. There's a lot of things that is discussed there that I've already know. Okay, but it's nice to have it reinforced and to learn. But then typically at most of the meetings, there's a few, maybe 2 or 3 takeaway newer things that I leave with that I think I might want to try with my patients. And so let me tell you what those were this time. And this was based on 2 presentations, actually 3 presentations. So one of the things that I think I'm going to start adding into my treatments a bit more that I haven't been doing as much over the last years is to start placing people on an enzyme, a group of enzymes called lumbrokinase. So lumbrokinase is a group of enzymes that are made by earthworms. I love this illness. We even have to resort to using earthworms, but they're enzymes that come from the skin of earthworms. And there's a couple things that they do in Lyme. One, they may break down biofilms. So biofilms are slime layers that can cover germs and block out the immune system and block out your antibiotics. Now, that's the main reason I used to use lumbrokinase before. But over time, I have found, and there's research supporting the idea that you don't necessarily need to put people on biofilm busters because probably the antibiotics and herbal antibiotics and prescription antibiotics we use can break through those biofilms or break them down, okay? So I've tended to shy away from using lumbrokinase for that reason, all right? But the newer reason that I've been starting to add it in since I got back is that it's based on presentations on Bartonella and one on Babesia that were done. And it looks like in both of these presentations, there's some evidence showing that one of the things that can occur with both Babesia and Bartonella is they can mix with the fibrin blood clotting proteins in your blood and form deposits that then attach themselves to your blood vessel linings or your endothelial cells in the blood vessels. And they form these Bartonella nest and Babesia nest. I'll call them nest, okay? And think of these nest as mixtures of fibrin, protein that holds together in this mesh Bartonella and or Babesia, okay? Now, when they're covered with this fibrin and they attach to the blood vessel walls, the fibrin acts as a barrier to keep your immune system out and to keep your antibiotics from getting through, okay? So one of the discussions was on Babesia, and the presenter was talking about just some really impressive results he was getting with some of his patients where he's having a hard time getting the regular Babesia antimicrobials to work, and some pretty impressive results. The other presentation was by Dr. Bozignani. Many of you know him as one of the leading Bartonella experts in the country. And he was providing some compelling evidence about these fibrin plaques or nests that develop in Bartonella as well, too. All right. So what can you do about this? Well, you got to get somebody on something that will break down the fibrin. Okay. Guess what lumbrokinase does? It breaks down the fibrin. Okay. So, and it's the other option you would have is nattokinase, but lumbrokinase is much stronger than nattokinase. Okay. So what I've been doing since I got back, and granted, I've only been back for 4 days, but on a number of my patients where I'm having more difficulty getting through their Babesia or their Bartonella treatments, I have been having them start to take lumbrokinase as a 20 milligram pill, one pill twice a day. The one thing about lumbrokinase, you need to take it on an empty stomach. Okay, so it gets to be hard to use it if you're also on binders at the same time for your toxins, and you may need to stage this. I mean, it can be really hard to use all these and have all the time delays and staggering that you need to do. Okay, so lumbrokinase, when I say on an empty stomach, what I advise my patients to do is Do not take any food, medicine, supplements, prescriptions beginning 1 hour before you take the lumbrokinase up through another hour after the lumbrokinase, okay? Now you can already see if you're also on binders, and binders, you're not supposed to take anything beginning half an hour before your binder and no medicines or supplements through 2 hours after your binder. You can see where this gets to be impossible to do both at the same time, okay? So in some of those patients, what I may do is put their pause their mold toxin detoxing until I can get their Bartonella under better control doing the lumbrokinase, okay? Now, lumbrokinase, you got a couple options in terms of products. There's a company called Candida RNA that makes a product called Boluke, and that's Boluke. There's one option. Also, Allergy Research makes a product that is lumbrokinase, and I consider both of them to be equally effective. The Allergy Research group product is a little bit less expensive. Also, through my supplement store, the Allergy Research product is a little bit even less expensive because I can discount it more than I am allowed to discount the Candida RNA product, okay? So I do carry both of those at my supplement store. Be aware on both of those products, you have to read the ingredients label. The ingredients label on both of them is confusing. So remember I said the dose is 20 milligram pill twice a day. If you look at the label, like on the lumbrokinase by Allergy Research, it says lumbrokinase 40 milligrams, okay? But you have to read the serving size. The serving size on that Allergy Research product is 2 pills, which equals the 40 milligram, which means each pill is really a 20 milligram pill, okay? So one of the big changes I'm looking at is in my treatments for people with Babesia and for Bartonella, where I'm having a lot of difficulty, I'm re-looking at the idea about using lumbrokinase, okay? All right. Second thing I participated in a workshop on Sunday on peptides. And I think I know I've been getting asked questions here about what I think about peptides. And so let me talk about what they are first. So peptides are strings of amino acids, okay? So as many of you know, there's proteins. Proteins are made up of amino acid building blocks. Typically, a protein would be about maybe 40 or 50 amino acids long or longer, okay? But anything that is 40 or less, we call a peptide. So they're shorter amino acid strands, okay? And so some of these might even be 5 amino acids, for instance, okay? These peptides that are being used as therapy that we might add in some of our Lyme treatments or have come to us out of the world of anti-aging medicine, for instance, are all substances that are naturally made within our bodies, okay? And so some of the doctors in the ILADS community that come out of working from the anti-aging community standpoint have been bringing into our world, considering using these peptides. So I'll talk about a couple of them, but one I've started using, and I am going to be incorporating into my practice, and I already have started using it, is something called BPC 157, okay? And that is it is a peptide that's made in the stomach. And the reason I would start using it is it's known to help do repair of leaky gut. It can repair damaged tissue like nerve tissue and joint tissue, okay? The other thing that it can do is to help rebalance an immune system that is out of balance, okay? And let me talk about that. So there's 2 parts to our immune system. Many of you may be familiar with the concepts of something called Th1 inflammation and Th2 inflammation, okay? Th1 inflammation is that system is made up of cells that fight germs, all right, that actually attack it. So white blood cells that attack Lyme, that attack Bartonella, that attack chronic viruses. The cells and the inflammatory cytokines that they make would be called Th1 inflammation, okay? Th2 inflammation is made up of white blood cells, beta cells that make antibodies, also made up of your allergy cells like mast cells, and it's made up of all the antibodies as well too. That's called Th2. When you are sick with something and you start developing autoimmune illness, you also get more Th2. And in Lyme disease, if you've been sick long enough, you might start getting more Th2 relative to Th1. Okay, so you get an imbalance. If you get too much Th2, that means you don't have enough activity going on here over in Th1. All right, so you want to get this rebalance so you get these cells in Th1 to start fighting infections better. So the protein, this BPC 157, has the ability to create balance of Th2 and Th1. Okay, so that's one thing I've started adding in. The company that makes that product, there's an oral product for it, and that company that makes it is called Integrated Peptides. And there are, let's see, I think they make 6 different peptides. I'm going to start working with 3 of them here initially. The other one I'll be working with, except they're out right now, is something called cerebrolysin, which is a peptide made in the brain that can help with thinking and neurologic repair. And then the other one I'm going to be working with is something called a TB4 frag. And TB4 frag is a protein, a peptide that comes from your thymus gland. It also is very useful at balancing this Th1, Th2. It has some other things that it does too. And then finally, there's a peptide that comes, something that is called KPV. That is a peptide that is part of something called melanocyte stimulating hormone. It's a chemical that stimulates the pigmenting cells in your skin. But if you take a portion of it, just a small piece of it, we call that KPV, and that may be useful in mast cell activation at calming down the mast cells as well too. Okay, so those are actually 4 that I think I'll be working with over time. The one that I've started to add into my practice at this point is this BPC 157, and I'm having people start at 1 pill twice a day, and I'll be reporting back to you as I see what the results are. At the conference, I saw some compelling information showing good improvements using all of these peptides, but I will be glad to report back to you more as I start introducing them into my practice, okay? So what's nice about these peptides is it's a way of fixing tissue damage, but it's also a way of trying to get your immune system turned on and recruit it to get working better to help you. So maybe we won't have to use as many of these antibiotics over time that we have been too. So I was impressed. I know many of you are maybe familiar with these webinars where I've talked with people who have been asking me questions, and I've called the peptides the latest new shiny object that everyone is rushing to. And I don't always try all these new shiny objects, but this is one I think I'm going to give some try to. And so I'll be glad to report back more in the future as I see what happens here with my patients. Okay. All right. All right. Thanks for that question, Patsy. Hello, Frank. Let's see. Hi, Dr. Ross. I'm taking Doxy plus erythromycin for my Bartonella. I had an adverse reaction to rifampin, so my eyelids doctor turned to Doxy. How long should I stay on this protocol? Thank you. Well, that's hard to say. So on average, all right, so a lot of it depends on how you do, okay, to be honest with you. But an average length of a Bartonella treatment is about 4 to 6 months. Usually, though, I want to treat until the symptoms of Bartonella are pretty much gone, or gotten them all better, but I can't get somebody all the way well, but we've been there for at least a couple months, okay? So I don't know how long you were on rifampin for, and I don't know what your symptoms are, but in general, we're talking 4 to 6 months, inclusive of all the things you use to treat Bartonella. So let's say somehow you were able to do the azithromycin rifampin for a month, then I would look at probably at least another 5 months or so that you would need to be on a doxy azithromycin protocol in general. Okay, now talk to your doctor. Your doctor is going to have a better sense of that, but given your case, so but that's what I would wind up doing. Okay, all right. Hello, Mary. Let's see. From what I have researched, I believe sciatica can be related to Lyme, Babesia, or Bartonella. If so, which tick-borne illness and how would you aggressively treat it? Okay. So by sciatica, let me tell you what sciatica means first. Okay, so sciatica usually means pain felt within the distribution of what is known as the sciatic nerve. Okay, all right. So the sciatic nerve is a nerve that runs kind of like down in this direction. Okay, runs right in through here, can even go down the leg a little bit too. And if you get pain in that area, that is neurologic pain, we call that sciatica. Now, what causes it? Well, one thing is you can get pinching of the nerves, either in the butt area or as they come out of the back, and so that would be you have nerve compression. So that could be a reason to have sciatica. You can also get sciatica if the nerves get inflamed from infection. So yeah, it could be Lyme or Bartonella. I wouldn't think so much about Babesia with that kind of situation, but yeah, it could be Lyme or Bartonella. And the treatment would be to treat those infections. I can't say so. And I would treat those infections. So I would treat the infections the way I would treat them, no matter what the underlying way is that it presents. Okay, so in terms of how I treat Bartonella, how I treat Lyme, take a look at my articles on that. It's a lot. Anyhow, take a look at that. I'm not going to go into the specifics on that. But you treat Lyme and you treat your Bartonella with either herbal antibiotics or prescription antibiotics. The other thing you can do is you want to get some of that inflammation under control to help with the pain. And herbally, you could do that using a curcumin, which is a derivative of turmeric, as many of you know. And I would have people do a liposomal variety of that. The liposomal product that I like for that is made by Thorne. It's called Mariva 500. And you would do 1 or 2 pills 3 times a day. And that's to start getting some of the inflammation down in that area. Okay? All right. Good luck to you, Mary. Hello, Teresa. Let's see. How do you handle mycotoxins and Lyme and dysbiosis? So, boy, that's a huge question. Okay, and that's because that's asking me what are all the approaches? How do you diagnose? How do you treat that? How do you diagnose? How do you treat Lyme? And how do you diagnose and how do you treat dysbiosis? I think I would need a little more clarity as to what you're asking. Are you asking which one would you approach first? Are you asking could you approach all of them at the same time? So I'll try to clarify it that way. So yes, you can treat mycotoxins by binding them. At the same time you use your binders, you could also treat Lyme and co-infections with antibiotics. And in terms of the dysbiosis, that gets to be a little complicated because if you're going to be using antibiotics to treat your Lyme and co-infections, you may be causing further disturbance of the healthy gut bacteria. And sometimes when we treat Lyme, we just accept that that's what the situation is going to be. The best you can do while you're on antibiotics is to try to put good probiotics back in to create better balance. The product I like for doing that, I like working with probiotics that are made up of human strains and also ones that are made up of soil-based probiotics. Okay, so soil-based probiotics are things that come from the soil. They tend to be what we call spore-forming probiotics. And those spore formers don't necessarily populate the intestines themselves, but they can promote a healthy balance of the good bacteria that is there already. And they can help the human strains of probiotics that you're having take hold, set themselves up, okay? The product that I like that actually has both of those in it, human strains and the spore-forming strains, is a product by Research Nutritionals, which is called Multibiome. It's MULTI-BIOME, and that would be 1 or 2 pills 1 time a day. The good thing about that product, it doesn't require refrigeration either, okay? All right. So thanks for that question. Teresa, in terms of the order you would do this in, I would need to take more of a history from you to try to ascertain what happened first and in you, what is giving the greatest problem. And that's why I'm kind of shying away from telling you step by step what to do, because I don't have enough information here to actually ask that, to answer that question. Okay? All right. Thanks for the question. No, good luck to you. Hello, Christina. I'm glad you're here. That was somebody wrote that message to me. Hello, Rich. Let's see. How could Lyme and co-infections cause mild bruises on the front of my thighs? They were not caused by any impact. Any ideas on what could be causing this? What is the best way to treat? So first of all, Rich, I don't know if you're on any antibiotics or antimicrobials at this point. As a side effect, some of the antibiotics can lead to easy bruising. It just does, okay? That could even be the herbal antibiotics as well, too. Short of that, if you're not on any antibiotics, the one thing you ought to do with your provider is just do some basic blood work to look at your ability to clot blood. That would be to measure platelets in your blood counts, which would be part of a CBC. The other thing would be to measure your ability of your liver to make blood clotting proteins. And that would be to measure something called PT and something called APTT. Okay, those are the blood tests that they would do. Okay, all right. Good luck to you. Hello, Eileen. Hello, Dr. Ross. Hope you enjoyed the Allieds conference. I did. Thank you. Have you tried using red light therapy combined with near infrared light to help with healing nerves and relieving pain, inflammation, and herxing? My husband and I both have Lyme and Bart. We have been using it for several months. It does seem to help, maybe killing germs. Thanks again for all you do to help us. No, I have not used that. I'd be interested to know more what's happening with you on that. You know, the infrared could potentially kill germs. I haven't seen any studies that show that it does in terms of Lyme. And then the red light therapy, I'm not quite clear how it would actually kill germs, but it may have some ability to help heal your nerves. Okay, so thank you for sharing that with me. I have to look into it a little bit more, actually. Okay, thank you. Hello, Regina. Let's see. I'm having a more serious Lyme-related concern. I believe I have a history of persisted Lyme disease, but I'm experiencing concern with possible Lyme disease-related brain lesion, which only occurs in about 1 in a million persons. It is an arteriovenous fistula brain parasagittal, which is affecting the Sagittarius sinus. So, Regina, I haven't seen that occur. Obviously, it's a rare situation, and I assume you're probably talking to some surgeons about what to do about that. I don't know off the top of my head on that one, okay? That falls out of my realm of expertise. I have not seen it occur in this illness, though, okay? All right. Good luck to you. Hello, Mary Elizabeth. Let's see. Dear Dr. Marty, I'm so appreciative of your unique dedication and your clear insights. Thank you. Thank you. Appreciate that. Like a question from your last webinar, I live in Arizona where the medical community largely does not understand Lyme. Recently, I saw a practitioner whose specialty is MS, but who admitted she knows nothing of Lyme. I tested positive by CDC standards for Lyme in 2005 and have a severe crippling case. Without giving me any actual exam, this practitioner believes that Lyme has morphed into MS. I suspect further expensive testing may prove to be a wild goose chase. My question is there any absolute way of telling the difference between MS and advanced neurologic Lyme disease? And 2, any thoughts on the possible relationship between the two? That's the $1,000,000 question. That's a hard one, Mary Elizabeth. So let me talk to you first what MS is and how we diagnose it, and then tell you what the overlap would be with Lyme. So in neurology, when somebody gets a neurologic diagnosis like multiple sclerosis or Lou Gehrig's disease or Parkinson's disease, these are all syndromes. And what neurology does is we look and see, do you have certain lesions on an MRI? Do you have certain neurologic symptoms? And if we check off all the right boxes that fit and the kind of things we might want to see with MS, we call that MS. It's a neurologic construct, okay? The trouble is with that neurologic construct, all that it does is describe the lesions, it describes the neurologic problems you have, but it doesn't say what caused it, okay? And that's the situation with most neurologic syndromes. They're syndromes. Neurology doesn't want to weigh in and say what caused it to happen, okay? Now, the neurologic construct that we call multiple sclerosis may have multiple different kinds of causes. One of those causes could be Lyme disease. Lyme could give you the lesions that then manifest as the symptoms that we see in multiple sclerosis, okay? So you then get into a semantics issue, all right? Do you call the lesions that fit all the check boxes for multiple sclerosis and somebody that has Lyme disease, do you call that all Lyme disease? You could. Or do you call it Lyme disease causing MS? Or do you call it Lyme disease with multiple sclerosis features? Right? And to be honest with you, all of those work. All right. So there isn't a set way of telling what came first in a sense. Okay. Now, there's also another possibility. It's possible to have Lyme, which gives its own problems, and then on top of it, get multiple sclerosis that is caused by a completely different problem. All right. The truth is, though, we have no way of distinguishing for sure, is MS caused by Lyme or not? It could be. We think it can be. And we have no way of distinguishing if you have MS that maybe isn't from Lyme, what else caused it? Okay. So you can call this whatever you want. You've got a neurologic syndrome. And that syndrome happens to fall in and check all the boxes of multiple sclerosis, maybe for what she's saying. You also have Lyme. And it's possible that Lyme gave you the MS. It's also possible they're two separate problems and you still need to keep addressing both of them, okay? Unfortunately, there's not a clear way of telling here. Good luck to you, Mary Elizabeth. Hello, Meg. Let's see. Thank you, Dr. Ross. These calls are fascinating. You're welcome. Let's see, me, 5.5 years with persister Lyme, mostly okay using resveratrol, teasel, cat's claw, glutathione, reishi, D3. Anyway, lots of herbs and vitamins. I now have eye issues. I do have cataracts that need surgery unrelated to Lyme. However, in the exam, it was discovered that I have retinal and optic nerve issues. I took 2 one-page articles to my new ophthalmologist on contrast sensitivity and Lyme and on retina and optic nerve issues. The doctor's response was, whatever. Few doctors here are versed in Lyme, and I've read that especially the retinal issues can create a more difficult cataract surgery or can be serious issues. My questions to you are, is there anything I can do to address any Lyme eye issues before and after cataract surgery? What can I do to protect my vision, Lyme-related issues? What else should I know about Lyme and eyes? This gets to be a tricky issue. I haven't seen anyone that I know of that is an ophthalmologist or optometrist that is entirely Lyme savvy, if you will, okay? When you get into some of the issues like you're having, you still need an eye doctor that can remove your cataract. You need your eye doctor that might use laser to take care of retina inflammation, for instance. Okay, so you need to let them use the tools that they use. In terms of your infections and inflammation covered by the infections, the best you can do, especially I would say going into a procedure, I like my patients to be on things that actually control the infection going into your procedure. So that could be antibiotic herbs or prescription antibiotics. I like to do that, okay? The other things I like to do is to use glutathione to help keep inflammation down. I tend to shy away from using the curcumin and turmerics or turmeric going, and cytoquels, like those things that lower cytokine inflammation more directly, because some of them may have some blood clotting issues, and I don't want to cause any problems as you get ready to do an eye surgery. Okay, but glutathione would be safe to do. And you could do like a liposomal glutathione of 500 milligrams once or twice a day. But also, I would probably still stay on your herbal or prescription antibiotics, because they act to kill germs, to keep any germs under control and inflammation from infection under control. But also, these antibiotics and even herbal antibiotics probably have an additional effect, and that is they are directly anti-inflammatory as well too. And in fact, I didn't see it here. Yeah, your resveratrol, which is something you might find as part of a Japanese knotweed, is a great anti-cytokine herb as well too. So I usually, going into these kind of eye procedures, would have my patients remain on their either prescription or herbal antibiotics, at a minimum be on glutathione going in. And if it happens that you're using herbal antibiotics that happen to lower cytokines, specifically like the resveratrol does, that's great. Okay. All right. Good luck to you, Meg. Hello, Frank. Let's see how Dr. Ross. Can amoxicillin be used to fight Bartonella? Thank you. No, actually, we don't think of it as something that's going to treat Bartonella. So Bartonella tends to live inside of your cells. Okay. So you need an antibiotic that can get inside the cell. Amoxicillin doesn't get inside the cells. It works in what's known as the extracellular space. So no, it wouldn't tend to have any effect on Bartonella. Okay. Thanks for the question, Frank. Hello, Dave. What do you think of using RIFE machines to treat Lyme and co-infections? Have any of your patients had success with using RIFE machines? Is there a specific brand of the RIFE machine that you normally recommend? Okay. So, RIFE machines go in and out of vogue. So everyone, what a RIFE machine is it's a machine that generates electromagnetic frequencies at a frequency. You choose a frequency that is thought to burst the Lyme germ and kill it, basically, or burst Bartonella and kill it, or Babesia. And basically what happens is, how you can take an analogy would be taking a singer and putting them in front of a glass of water, and they sing at a frequency that breaks the glass of water. Okay, they're vibrating that glass to burst it. You can find electromagnetic frequencies that would vibrate the covering of the germ to kill it. Okay, so that's in theory how it's supposed to work. What I can tell you is that I've had a number of my patients that have used RIFE without me recommending it. And the reason I can't recommend it is the Food and Drug Administration has frowned badly on doctors that recommend RIFE, and has actually gone after them and even done criminal action against them. So I'm not recommending RIFing, okay? What I am saying is I have seen people that have done it on their own. And what I see in people that have done it on their own is that they get about 30 to 40% report some improvements, okay? So that's what I've seen in my practice. Now, a couple of years ago, a group called LymeDisease.org, which used to be called the California Lyme Disease Association, did a research study. They have a project called My Lyme Data, where they have about, I think, 13 or 14,000 people enrolled now. These are people that have Lyme. Anyone can sign up to join their studies that has Lyme. You fill out a questionnaire, and eventually they go back and they re-sample some of those people in their data bank, and they ask them follow-up questions. Okay, so 2 years ago, their big study was on what alternative medicines have you tried? What side effects did you have? And did it work? Okay, their data, I think, shows that about 30 to 40% of people report some improvement using RIFing. Okay, so that kind of fits with what I was just describing to you too. So I don't think that for the majority of people, it is the thing that's going to get them all the way well. I think when it does work in those 30 or 40 people, it's helping, okay? But I don't think it's the thing that's going to get everyone all the way well. If you are looking at a good resource book about how to RIFE and what kind of machines you might use, Brian Rosner, who is a writer and has written a lot about Lyme, at one time thought he had cured himself of Lyme with rifing. I don't know that he so much believes that now, but he did a good how-to book on RIFE machines, Brian Rosner on RIFE machines, and it was a good how-to book. He says a number of things in there about his theories of antibiotics that I don't agree with, but in terms of a manual about how do you RIFE, that's a good resource. Another resource that you can look at is there is a PhD by the name of Nina Silver that has written a book called the RIFE Frequency Handbook, I believe that's what she calls it, which helps you find frequencies that might work against the different germs, okay? Now, the reason the FDA is against doctors recommending these things is they claim there isn't adequate science that shows it works. Number two, there hasn't been adequate studies done from their standpoint looking at safety issues. So I can't guarantee they're safe to do, okay? You're bouncing EMFs through you. I can tell you we live in a world of EMFs, and I don't think everyone's dropping down from EMFs, but you have to be concerned about that, okay? Now, I'm going to do one screen share here. I haven't done one yet, but this is going to be my first screen share for tonight. So I've written an article about how do various alternative medicine treatments work? How effective are they? Okay. And let me see, where would I have put that? Let me see if I put it here. No. All right, and I'm just going to write alternative medicine up here in my search box. Yeah, here we go. So this is the article. It's called What Works? Navigating Prescription and Alternative Medicine Lyme Treatments, okay? And in here I talk about RIFE machines, stem cell therapy, ozone, hyperbaric oxygen, hyperthermia, like the German clinic in Mexico, SOT, low-dose immunotherapy, IV hydrogen peroxide. All right, so take a look here. And in here, I do show some of the data from my Lyme data, all right? And down here, for instance, is a chart that I have that talks about the benefit in their survey. So for RIFE machines, it's this line right here, 35% of people that have done it report moderate or more than moderate improvements, okay? Ozone and other oxygen therapies, 40%, okay? So I know a lot of people are doing IV ozone and rectal ozone and IV hydrogen peroxide, et cetera. They help about 40% of people. And as I've said before here in this forum, I don't think they're good germ killers. I think the way they work is to get your mitochondria working better, actually. Hyperthermia, like in the German clinics, helps about 45% of the time. Now, I will tell you, even though they're reporting that the hyperthermia works 45% of the time, my experience says these improvements are not sustained. That hyperthermia does not wipe out the germs the way that the clinic George says it does in Germany, or in some of these other hyperthermia clinics do, but it is something that can help. The one that was really disappointing, though, is stem cell therapies. A few years ago, this was the rage. Everyone was rushing to do their stem cell therapies. In the end, people say about 3% of the time they got help from it, okay? Anyhow, you can look here at this. If you're looking for some ideas on what different alternative therapies do, take a look here, okay? And then down here, if you want to know why I'm opposed to using ozone hydrogen peroxide to kill germs, take a look. I have a link to the article here explaining why I don't think they kill in a living human, although they may give you benefit on your energy because they promote better functioning of your mitochondria. Anyhow, I make those comments here in this article, okay? All right, Dave. I guess I gave you a mouthful there, but I hope that gives you some information to look at, okay? Oh, in terms of machine, the one that I'm aware of that some of my patients have used and I think looks like good quality as I've looked at it and even talked to the manufacturer is a company called Coil Machines, COIL and then machines, okay? And it's designed on what is known as a Doug Coil design. Doug McDonald is actually a true person that lives out here in the Pacific Northwest that was one of the first people to design this wire coil called a Doug coil that generates electromagnetic frequencies. I think the Doug coil's design tends to be the strongest way to do rifing. Now, if you go to Coil Machines, I want to just make sure you wear something. So they're expensive. I mean, any of these RIFE machines can be very expensive. the coil machines has been trying to promote that you have to get 2 coils and 2 amplifiers, all right? I'm not quite sure that gives you any more benefit. I think you can sit close enough to the coil to get enough energy generated that you don't need to buy a double setup, if you will, to be able to get benefit. Okay? All right. Good luck to you, Dave. Hello, Santiago. Say, hey, Dr. Marty, should one retest the Lyme labs after 2 years, or should one go on symptoms after? So I am not a big believer in retesting your Lyme labs, and let me tell you why. Okay. All right. So when we're measuring Lyme labs, the 2 main ways that we can look to see if you have infections at this point are either to do antibody testing. Those would be things like a IFA or a Western blot or an immunoblot. Those tests are looking to see, is your immune system making antibodies that attach the germ? Okay, so that's one way, but it's an immune system test, okay? The second major way that we can do diagnosis these days that is can be effective is to do what's known as a T cell activation test, also known as an ELISpot. This would be things like tests done through Infectolab or tests done through Armin Labs, okay? And what these T cell activation tests do is they literally take white blood cells out of your blood, and they look to see in a laboratory if they introduce proteins from a Lyme germ or proteins from a Bartonella, do these T cells react? And what they're measuring to see if they react is, do they release cytokines? The only way they're going to release cytokines is if they have seen that germ in you before, okay? So that's an immune reactivity test as well, too. It's a T cell immune reactivity test, or we got the antibody reactivity test, which would be a Western blot or immunoblot, all right? So some doctors believe that if you are positive at one time and then they go back in and retest these tests again and you're negative, it must mean the germ is gone, okay? And I would say is wrong because, first of all, no one has ever tested to make sure that that theory is right. No one has done any studies that says the level of antibodies you have on an immunoblot or Western blot or the amount of reactivity you have on an ELISpot corresponds with germ load. There's been no studies done. No one has studied it to say high levels of a T cell reactivity means you have billions of Bartonella in you. No one has done those studies at all. Okay. All right. Now, as I mentioned earlier tonight, one of the problems we run into in Lyme is you get immune system imbalances. Okay. And one of the things that can happen if you have a lot of germs raging in you, you may get immune suppression from those germs. Okay. So if you have a lot of immune suppression, your Western blot may become negative, or your ELISpot may become negative, but guess what's happening? You got a raging party of germs going on in you, all right? And so the raging party of germs may be suppressing the immune system. And if you go back and you do that test and it looks like everything is normal, that doesn't mean the germ is gone, okay? So I don't trust those ways of doing it. Once you get a positive test, probably the best thing you can say about Lyme testing and Bartonella and all the co-infection testing at this point is it gives you some evidence that at some time your immune system reacted against those germs. And at that time, you have evidence the germ was in you. But we do not have any testing we can do at this point in time that tells us what the germ load is now or whether the germ is completely out of you. And so for that reason, I don't do the retesting. I think a lot of my colleagues doing it I think they're wrong in doing it, to be quite honest with you. And so what I believe we should do is follow your symptoms. Gauge what is happening based on your symptoms, okay? And unfortunately, we just don't have a done test, okay? All right. Good luck to you, Santiago. Hello, Marge. Let's see. I fell about 10 days ago and really hurt my bum. I'm still really quite sore. Does it generally take us Lyme patients to recover from an injury than those that don't? Oh, I think it's very individual. I think that some people with Lyme recover just the same, as much speed as anyone else does, okay? What I can tell you about inflammation in general from an injury is inflammation from an injury often will take at least 6 weeks to go away, even in people that don't have Lyme, okay? And if you really hit yourself hard, you probably still have a lot of inflammation going on. And the way inflammation works from injuries like this is it usually maximizes at about 48 to 72 hours after the injury, and then again can take up to 6 weeks on average to go away in people that have Lyme or don't have Lyme, okay? So I haven't seen any tendency, though, among my Lyme patients that says that they take longer to recover from this type of inflammation, okay? Good luck with your recovery from that. All right. Last week, in preparation for antibiotic therapy, I started using spore-based probiotics. After 3 days of using these probiotics and not yet the antibiotics, a good portion of my fatigue went away. Is there some role spore-based probiotics play in combating fatigue? I'm pleasantly surprised and curious to understand what happened. Also, are little tiny red dots all over the torso, neck, and arms part of Lyme and co-infection symptom picture? Okay, so spore-forming probiotics, there's some data out there that shows that they may help regulate your immune system in a way that it can become more active. It can help promote healthy functioning of your immune system. That is the only way I can think you might have gotten some help with your energy. Maybe your immune system started working better, got your germs under better control. I am not sure of another way that they would have added to your energy. I'm not denying it happened. There is also a Marty Ross MD rule of medicine, and that is anything can happen to anyone with anything. All right, so there's the common side effects and effects we see from medicines, and then there's the real world things that happen to people. And even though something like getting improved energy from spore-forming probiotics is not a common effect that people get, you're your own unique laboratory. We all are, okay? And for some reason in you, there was something that happened that allowed that to give you more energy. So probably keep using it. I mean, if it gives you benefit, keep using it, okay? All right. In terms of those tiny red dots can sometimes be seen in Babesia. They sometimes can be seen in Bartonella as well, too, okay? They also sometimes can be part of a problem of having too low of platelets. And so if you've got a lot of them, you should check in with your primary care doctor or your Lyme doctor, see if they can do a complete blood count that would include platelets to make sure you've got enough platelets going on, okay? But if you do, then it may be that these are small, I call them hemangiomatous type spots that you can sometimes see in Babesia or Bartonella. I tend to think of them being as more Babesia, but they can occur sometimes in Bartonella. And then you just go down the list of your Bartonella and Babesia symptoms to see if you have more of one or the other to figure out if it's part of that. Okay, so symptoms that can indicate Babesia would be night sweats, headaches in the front of your head, panic attacks, racing, skipping of your heart, getting low blood pressure when you stand up, and sometimes increased deja vu experiences. I like that one as a Babesia symptom, and sometimes having these little red blood spots and air hunger, okay? Bartonella common symptoms can be neuropsych, so neurologic dysfunction like neuropathies, which would be nerve pain, or could be numbness, could be tremors and shakes, could be bad depression, bad anxiety, severe cognitive issues. Those are things that make you think of Bartonella. Pain on the soles of the feet, air hunger, and these little spots. So Babesia and Bartonella both can give you air hunger and give you these little spots for different reasons, but they both can, okay? Hold on here just a minute. Anyhow, I hope that answers your question. Good luck to you. Hello, Christina. What do you think of ozone IV therapy? So I think I kind of mentioned that earlier. So ozone, let me just talk to you more detail though. So ozone and hydrogen peroxide, high dose vitamin C, UV blood irradiation, these are all known as oxidizing agents, okay? And in theory, if you use an oxidizing agent, it can damage a germ covering and damage the DNA of the germ and kill it, all right? So for instance, if you were to take a test tube full of germs in the lab, dump ozone into it, you'll kill all of them, all right? That looks great. So people think, aha, best germ killer in the world, okay? Here's the problem. Your blood is full of antioxidants, all right? And those antioxidants can neutralize the killing effect of ozone. So there's been experiments done, and this is by one of the godfathers of ozone therapy. He did experiments looking at what happens if you put a test tube full of germs and you put a little bit of blood in it, just a drop, a smidge of blood in there, and then you add the ozone in. Guess what? No killing, okay? So no killing at all. So I know a lot of my colleagues out there are promoting their ozone and their IV hydrogen peroxide and their rectal ozones and all that stuff to kill your germs. I don't buy it. I just don't buy it because the lab experiments say there should be no killing if you put it in the blood. Now, I will contend, I do concede that some people, when they get their ozone, they get their hydrogen peroxide, they feel better, okay? And there's an explanation for that. So the same godfather of ozone and some of those that really have promoted ozone, a lot of the reason they're promoting ozone is because it probably helps, and the hydrogen peroxide, all these therapies, probably improve the functioning of your mitochondria in the body, okay? So your mitochondria are your cell energy factories. And when you get an ozone infusion or rectal ozone, that can cause better oxygen burst or oxygen consumption of the mitochondria, helping them to function better. So you can feel better because you got an energy burst coming out of your mitochondria. And I think that's the real benefit of doing ozone, okay? In that sense, it may even help the immune system work better because you're powering up the immune system. But as a germ killer itself, I don't buy it. I just don't, if you look at what the data says on that, okay? All right. Thanks, Christina. The other thing I would say is I just don't see people getting universally good results from it in terms of a germ killer. And if you look at the study that I showed you from my Lyme data, 45% of people report benefit. But that I see better benefit. I could probably give you better benefit for people that try herbal or prescription antibiotics than that 45%. Okay. All right. Thanks for that question. Hello, Paula. So let's see, thymosin alpha-1 and LL37 makes me herx. Okay. So Paula's talking about two peptides, thymosin alpha-1 and LL37. I suspect you're probably, the LL37 is only available by injection. The thymosin alpha-1 is at this time only available by injection, although I believe integrated peptides in their TB frag 4 would be, no, I guess it's not the same. But anyhow, these would be injections. Okay, now, two things. Number one, both of the thymosin alpha-1 can help get your immune system working better. And if it is getting your, so I said thymosin alpha-1 is actually different than the TB4 frag. I'm looking at my cheat sheet over here. I said I'm just learning about this, okay? And yeah, thymosin alpha-1 would help your immune system work better. Therefore, it might kill germs, okay? The other thing is there are certain of the peptides that may have germ-killing properties. One of those is the LL37, and thymosin alpha-1 actually has an antimicrobial effect as well too, okay? So you may be getting what looks like a herxheimer reaction because you have some germ killing going on, but you may also be getting it because of your immune system is able to attack the germs better on those too, okay? All right. Good luck to you, Paula. Hello, Christina. Let's see. Do you recommend hyperbaric oxygen chamber? In some situations, yes, but let me explain for what. So hyperbaric oxygen means going into a dive chamber that can have high pressure A hard shell chamber is probably the best. It can give you pressure up to 2.4 atmospheres. That would be like a deep dive, okay? You can use soft shell chambers that can go maybe to 2, maybe 2.2, but not much higher than that. If we look at what hyperbaric oxygen could be used for, number one, that high pressure, if you're on antibiotics, can be very useful at forcing the antibiotics deeper into your tissues, okay? The oxygen may have some germ-killing potential, but I don't think that it really works that well, okay? About maybe 6 or 7 years, probably about 10 years ago now, there was a big move where everyone was having, all these Lyme doctors in the country were getting their hyperbaric chambers. There was a big one down in Chico, California, that was operated by a physician. I believe he had Lyme himself, but family members too. So they were really using it as a means of treating Lyme. In the end, most of us that were working with hyperbaric, because I used to refer people for it too, wound up really just becoming disenfranchised. I don't see that for most people from a germ killing standpoint, that most people had a sustained benefit from doing it, okay? Where I do see reasons to use hyperbaric oxygen is in people that have a lot of neurologic brain impairment, because hyperbaric oxygen also can help get your nerves functioning better and reattached in the brain. So there's a concept called brain neuroplasticity, where nerves that are injured can be reconnected to other nerves around them and get working again, okay? And one of the things that promotes that is hyperbaric oxygen. So I think it could be useful in people that have severe brain, central nervous system, brain dysfunction. I don't find it to be very useful as something that does germ killing per se, okay? All right. Good luck to you, Christina. Hello, Dana. Hi, Dr. Ross. I have a question about testing. I took an IGeneX test and was positive for Lyme IgG antibodies, but only had 1 positive and 2 indeterminate bands for the IgM antibodies. I've had a very strange lower abdominal distension that's very painful and never goes away, dizziness when standing up, numbness in my limbs, inflamed knees, sleep disturbances, etc. How do I tell if this is caused by Lyme or something else? So, Dana, I thank you for giving me all the symptoms. I would even need to ask you a lot more questions. So the way that you make a Lyme disease diagnosis is solving a puzzle, and sometimes the puzzle is not certain, okay? So there's 4 things we consider, all right? Number 1, do you have a lot of symptoms that look like Lyme, okay? And if you're looking to see if you have a lot of symptoms that look like Lyme, fill out the Horowitz MSIDS questionnaire. You can find it online. And if you score high enough, you have enough symptoms that look like Lyme. Okay, so does it look like a duck? And if it looks like a duck, there's a chance it's a duck. Okay, so if it looks like Lyme, there's a chance it could be Lyme. So see if you have enough of the symptoms. The Horowitz MSIDS questionnaire can help you do that. Okay, all right. Number 2, is there a risk you could have gotten Lyme? Okay, the biggest risk that you could have gotten Lyme is having a known tick bite. That's the biggest risk. Okay. Other risk would be, do you do activities that could have put you in contact with a tick and you didn't even know it? So one of the biggest problems with ticks is baby ticks can spread Lyme. They're the size of a poppy seed. You may not even know you got the tick bite, okay? But if you're a hunter or a fisherman that goes out into the bush to fish, those are high risk, okay? If you're a backpacker that goes into the bush, those are risk. If you're a person that lives in the northeast of the United States, especially in New Jersey, where 95% of ticks are shown to have Lyme, you're a risk by just living in New Jersey. If you're out on the Cape and Cape Cod, that's a huge risk because there's all kinds of ticks out there that carry Lyme, okay? So you got to look at, could you have gotten it, okay? And some of that involves looking at what are your life activities. Could you have run into a tick? And the other ones would be, do you actually truly have a known tick bite? Okay. All right. So those are 2 things. Horowitz, make sure, see if you have symptoms that make you look like a duck. Okay. Number 2, consider, are you at risk of having gotten Lyme? Okay. Number 3, are there any physical exam findings? Now, truth is, many of us don't have any physical exam findings of Lyme, because Lyme is primarily a subjective illness. It's about how you feel, okay? But sometimes you can see neurologic signs on an exam, okay? All right. And then the 4th thing we consider is, do you have a test that supports having Lyme? And in your situation, you do. That IgG that's positive means that at some time in your life, your immune system has had to respond to Lyme. Okay, now let's talk about IgMs and IgGs. So IgMs are the family of antibodies you develop in an infection during the acute phase. And in infections, they are supposed to, did you hear the word supposed to, go away by around 3 weeks to 6 months and get replaced by IgG antibodies. Once you make IgG antibodies, they serve as the memory of the immune system. They're what give you ongoing immunity, for instance, when you get your COVID vaccine or when you had your polio vaccine, okay? They are not supposed to go away, or if they have gone down to the point they can't be measured, they'll turn on really quickly once you get that infection reintroduced to you, okay? So IgGs are your memory. When you see an IgG, you cannot tell just looking at the IgG, is the germ still in you or out of you? But it does mean that it's been in there, okay? All right, now, IgMs are tricky in Lyme. And more recently, we're learning IgMs are tricky in Bartonella too, okay? For some reason, and we don't know why, there's theories about why, but we have data that tells us that about 50% of the time that somebody has chronic Lyme, that their IgMs don't go away, all right? This is years down the road, all right? And it's not supposed to be that way, but it is that way, okay? So having some of my patients that have had Lyme for years, the only thing that tests positive is an IgM. Some infectious disease doctors would want to call that a false positive because they would say it's not supposed to be there if you've been sick all those years. But they don't understand that this is a situation that does happen in Lyme, and we are not fully certain why it happens, okay? All right? So you do have some positivity there too, okay? So I don't know enough about your symptoms. You wrote about some of these here. I would need to know a lot more. But if you score really high on a Horowitz questionnaire, and if you happen to have great risk of having gotten Lyme, and you have this positive IgG, I would probably handle it as a Lyme case. That would be in my practice, okay? Absolutely, you should be talking this over with a doctor who knows all about you, though, okay? I'm just getting a little snippet here, okay? All right. Good luck to you, Dana. Oops, what happened there? There we go. Hi, Christina. See, after long-term antibiotics therapy, can you ever really get your microbial back in check? Also, if just using herbs, can you really get results? Okay, so in terms of your gut microbiome, I think that's what you're referring to, the germs that make up your gut. It's hard to say. I mean, you know, there's the whole idea with the gut microbiome, that whole area about what is going on with those germs in your gut and what goes on with the makeup of the germs is a hot area of investigation right now. And there's been a lot of studies. There's been like an exponential growth in research about what is going on with all those germs, okay? So to put this in context, if we look at the amount of genetic material that is in our body, 90% of the genetic material in our body is from the microbiome. The viruses, parasites, bacteria, fungus, and yeast that live in our intestines, 90%, okay? So that stuff must be there for some reason. As I've said here many times before, we're just not innocent in letting all these germs live in us. We're getting something from it, okay? So some of the things we're getting is they aid in food digestion, they help remove toxins, they modulate our immune system, they release neuropeptides that help our brain work. They do a host of stuff, and we probably have only begun to scratch the surface of what they do. They probably make up for genetic defects that we have, okay? I mean, there's a bunch of stuff that they can do. So some of the studies suggest that even after a 10-day course of antibiotics, 4 years down the road, your gut microbiome is still not back to normal, all right? So in using these antibiotics that we do, we're doing it weighing out risk and benefits. Okay, so there's great risk in not getting your Lyme under control. All right, but there's also risk that you're going to interfere with the good microbiome. And at a point when Lyme is raging so bad that you got to knock the germ load down, you really don't have a choice. Okay, now, in terms of what gives more destruction to the good balance of your microbiome, probably prescription antibiotics are worse than herbal. Now, I have heard Stephen Buhner talk before, as in Buhner Herbs, talk about, write about, I believe, that he doesn't think that the herbs do as much in the way of disturbing the microbiome. I disagree. I've had a number of patients that I've had primarily on herbal or exclusively on herbal antibiotic regimens that still go on and get intestinal yeast. Okay, so it's doing something. Those herbs are doing something, but I don't find the problems with intestinal yeast overgrowth, for instance, that I do on herbal antibiotics that I do with prescription antibiotics. Okay, all right, then the chances that herbal antibiotics will work versus prescription antibiotics. This is what I see in my practice. For the Lyme germ, herbal antibiotic protocols versus prescription antibiotic protocols have about equal chance of helping. All right, that's just what I see in my practice, okay? In terms of Babesia regimens, there's probably about herbal regimens work about 85% of the time, versus prescription is going to work more about 85% of the time. So maybe about a 5% better chance that an herbal regimen will work well for Babesia versus prescription. For Bartonella, I tend to find that there's about a 10% better chance that prescription regimens are going to work better than herbal antibiotic regimens. And so prescription, any two antibiotics that I might put somebody on work about 85% of the time. The herbal antibiotic, any two that I put a person on is going to work about 70 to 75% of the time. Okay, that's what I see in my practice. All right, okay. Good luck to you. Hello, Charles. Hi, Dr. Ross. Can Cryptolepis be satisfactory standalone Lyme treatment, especially while you are taking binders for mold? 2, what are your thoughts on COVID antibody tests? Are they accurate? Okay, so I'll answer the first part. So Cryptolepis has gotten some interesting science that's been developed over this last year or performed. And so we now know, historically, we thought Cryptolepis was an herb that only killed Babesia. Okay. But Johns Hopkins over this last year has produced a number of studies now showing that it can kill growing Lyme, can kill persisting Lyme, it can kill, at least in laboratory experiments, it can kill growing Bartonella and can kill persisting Bartonella. Okay. Now, based on those studies, which are newer within about 6 months or so, I've started introducing Cryptolepis into my regimens. I've seen good improvement. I don't know that I would use it as a standalone at this point. And that's because I haven't worked with it enough to know. This idea that we can use it to kill Lyme and kill Bartonella really is a new concept, all right? So I don't know. I'd be interested in finding out, but I honestly don't know, okay? Let's see. What are your thoughts on COVID antibody tests? Are they accurate? So COVID antibody tests are primarily accurate. So I'm not an expert on this, okay, but I'll tell you in generalities what I know. So when you first get sick with COVID, it's going to be hard right in that moment to detect antibodies because it takes antibodies a time to rise, okay? But I believe it's within a week or two, and this is where I'm going to be a little sketchy. Within a week or two, you should start seeing antibodies. So they're accurate if they're there, okay? The trouble is the antibodies wear down in terms of your ability to detect them with a blood test pretty quickly. Now, that doesn't mean you still don't have the antibodies in you or that you can't suddenly turn around and start making them if you get re-exposed to the germ because you've got memory B cells. B cells are where antibodies are made. You've got a group of B cells that remember COVID, either from the vaccine or from getting it, and they will rapidly turn on and start making those antibodies in the future if you get re-exposed, okay? But in terms of a test that you can use to prove you're immune to COVID, it's not useful at all, right? Because they wear out pretty quickly, actually. I just don't have the actual number of days off the top of my head, but sometime within that first month, I believe it's in the first month, they kind of wear out really fast. So it's not a useful tool to see if you're immune, okay? It's just not. The best way to get immune is to get the vaccine. And that's the best way to probably prevent this thing. Is more, it has better chance of preventing COVID complications and COVID death and bad COVID outcomes than ivermectin. It has better outcomes probably than even relying on your own body's natural immunity, to be quite honest with you. Okay. So anyhow, I hope that gives you some useful information. All right, everyone. That's it for me for tonight. I've got to get a couple of Basenjis out here, my two dogs, and I'm actually I have an evening ahead of having dinner with my daughter. So I haven't seen her in a bit here. So she's goes to the University of Washington here in town, and it's time for me to catch up. So I'm going to be doing that tonight here in a little bit. Keep your eyes out on your email tomorrow morning between 9 and 9:30, and you should see an email from me announcing that the webinar recording is done. Sometime tonight, I'll do an edit on that, as well as do a brief synopsis of what we talked about. And again, I request that you help me, help spread the word. Tomorrow morning, when you get this email, if you think others would benefit from the material or knowing about these webinars, share it. Send out that email to other people you know. Okay? All right. Good night, everyone. Good to see everyone tonight. Bye-bye.